Good evening, everyone. My name is Basma Saady. I'm a radiology resident in Shamsi University Hospitals. I'm so honored to be here among all of the radiology pioneers, and I'll be presenting an emergency embolization case that was done in our interventional radiology unit. Case courtesy Dr. Karim Abtawab and Dr. Rana Khafik. Here we have a 48-year-old male presenting with recurrent attacks of abdominal pain, recurrent hematemesis, and hemoglobin drop. Further investigations were done, including labs, CBC, ultrasound, endoscopy. This is the image of the ultrasound that was done showing abnormal vascular structure with positive color Doppler. So a CT mesenteric angiography was done. This is the 3D reconstruction image along with the film. Can anyone outline 3 abnormalities in this 3D reconstruction? Anyone? So we have here different aneurysmal dilatations, as we can see here, in the abdominal aorta, in the left femoral artery, and here in the region, in the upper abdominal region. We can also scroll through the film. If anyone sees any abnormality, please raise your hand. You can concentrate in the celiac axis and the superior mesenteric artery, please. First of all, this is the celiac trunk, and followed by the superior mesenteric artery in a few seconds. Can you see this abnormal structure filled with contrast? This is 2 images. They are corresponding to each other. The first is non-contrast image, and this is the contrast image. And here we can see the abnormal vascular structure filled with contrast surrounded by a hyperdense hematoma. So we can take a minute discussing the normal hepatic artery anatomy. In 70% of the cases, the hepatic artery arises from the celiac trunk along with the left gastric and the splenic artery. This is only in 70% of the population, is the classic presentation. But here in our study, the superior mesenteric artery gives arising to the common hepatic artery along with the gastroduodenal artery, which only represents 2% of the general population. This is a coronal image. Here we can see the common hepatic artery arising from the superior mesenteric artery and an abnormal structure, an aneurysm in the gastroduodenal artery. The patient was admitted into the IR unit, and through a very tiny puncture, femoral puncture, and selective catheterization of the superior mesenteric artery, we can see that the common hepatic artery arises from the superior mesenteric and further divides into the hepatic artery proper and then the gastroduodenal artery. And of course, here we can see the clips of the endoscopy. Only 2%, as we've mentioned before. This aneurysmal dilatation receives its blood supply from 2 further arteries. This one, the upper one here, this is the right gastroepiploic artery, and then down here, it's the superior pancreaticoduodenal artery. So in this case, we perform a technique called front door, back door technique, in which we sandwich the aneurysm between the coils. So first, we put a coil into the back door. We proceed the cobra catheter into the aneurysm, and then we put a coil to close the back door of the aneurysm. This is the first coil that closed the right gastroepiploic artery and then the superior pancreaticoduodenal artery. Further coils, as we proceed, we put more coils to thrombose the actual aneurysm. Then we pull it a few millimeters to close its front door. Here, this is a very important image that we can see the resparing of the common hepatic artery, which is very crucial. This is the control ultrasound. We can see that there is no flow by the ultrasound in this vascular structure, which is the GDA, gastroduodenal artery aneurysm. The follow-up of the patient, the hematemesis stopped, the patient improved, and he was discharged 2 days after the procedure. Can we take a minute discussing the differential diagnosis of multiple aneurysmal dilation in large arteries? Just give me 2 clinical scenarios. تفضل يا دكتور كارم. تمام. Another one? The gastroduodenal artery is commonly injured in the posterior duodenal ulcer. So this is very important to take notes of. Thank you.